Welcome to This Explainer. When you think of a medical practitioner, you might picture someone in a white coat running lab tests. But in traditional Chinese medicine, or TCM, they're actually more like a medical detective. We're going to dive into how they uncover the hidden imbalances of the human body using one of their absolute most powerful tools. They don't just look at a localized symptom. They investigate your entire bodily ecosystem through a highly structured, incredibly detailed line of questioning. So think about this for a second. What on earth could your sweat, your dreams, or even just a random taste in your mouth tell a doctor about your heart? Well, this question perfectly frames our investigation today. Because in TCM, these seemingly random daily habits, the things we usually just brush off as totally insignificant, they're actually vital clues. They are your body's way of broadcasting exactly what's happening right beneath the surface. Here's our roadmap for the investigation. We'll quickly cover the 4 diagnostic methods, the purpose of asking, investigating daily habits, tracing internal patterns, and finally, completing the diagnosis. Let's jump right into Section 1, the 4 diagnostic methods. To really get the immense power of this medical interrogation, we've got to take a quick step back and look at the practitioner's primary toolkit. In TCM, diagnosis is built on 4 pillars, known as SIJIN. First up, looking. Observing your complexion, posture, and tongue. Second is listening and smelling, evaluating the sound of your voice or any distinct odors. Third is asking, or wenjen. And finally, palpation, which includes the super complex art of pulse diagnosis. These 4 pillars form the whole foundation of clinical assessment, with asking sitting right smack in the center, acting as the bridge that connects the whole shebang. Moving on to Section 2, the purpose of asking. Now, you might be wondering, what makes asking so critical compared to the other 3 methods? Why dedicate a whole diagnostic pillar just to having a conversation? Well, the answer really comes down to the limitations of our own senses. Asking, wenjen, is the specific tool used to uncover the invisible. It's all about gathering subjective information directly from you, the patient, to understand internal feelings and experiences that literally cannot be seen or heard from the outside. I mean, a practitioner can see if you look pale, sure, but only you can tell them if you feel a deep, chilling cold in your bones, or if you're holding on to some emotional trauma. Asking pulls out all those nuanced details about your lifestyle, your constitution, and your emotional state. And this brilliantly illustrates the contrast. On one side, we have objective observations. These are your external signs: physical fatigue, pale complexion, rapid pulse. On the flip side, we have subjective sensations. These are your internal habits, highly specific functional complaints, and emotional causes that only you are privy to. While looking and touching reveal the objective exterior, asking extracts the vital subjective experience from the patient themselves. It basically gives a voice to the body's silent struggles. All right, Section 3, investigating daily habits. This is where the detective work truly gets fun. It's honestly fascinating how specific the diagnostic mapping gets with something as simple as sleep. In a standard consultation, you might just say, "Hey, I'm tired." But to the TCM detective, not enough information. Do you have difficulty falling asleep? That points specifically to a heart, blood, or yin deficiency. But what if you do sleep, yet you have excessive, exhausting dreams? That points to a gallbladder or heart disturbance. Waking up way too early, say around 3 a.m., classic sign of liver yin deficiency. And if you're sleeping way too much and still feel heavy, that's pointing to an accumulation of dampness. Your sleep is literally a direct breadcrumb trail to specific organ imbalances. Similarly, let's look at taste, temperature, and sweat. Your preference for hot or cold drinks helps the detective map out your body's delicate yin and yang balance. Like excessive thirst indicates heat, but a distinct lack of thirst points to cold. Do you frequently wake up with a bitter taste in your mouth? That's a major red flag for liver and gallbladder heat. Even the exact timing of your sweat is a huge clue. Sweating spontaneously during the day, when you aren't even exerting yourself, points to a qi deficiency, meaning your body just lacks the energy to keep the pores closed. But sweating specifically at night while you sleep, that points straight to a yin deficiency. Even the way you describe your physical pain acts as a unique fingerprint for the disease. For a TCM practitioner, it's never just pain. They're going to ask about the exact nature of the sensation. A dull, lingering soreness? That generally points to a state of deficiency. The body is lacking nourishment right there. A sharp, highly localized fixed pain that feels almost like a needle, that points directly to blood stasis. The blood is literally stuck and not flowing. But what if the pain moves around, migrating from your shoulder one day to your elbow the next? That migrating sensation reveals an invasion of a wind pathogen. The actual vocabulary you use gives the detective the exact nature of the pathogenic factor at play. Which brings us to Section 4, tracing internal patterns. Once all these seemingly disparate clues are gathered from your daily habits, the detective has to connect the dots. Let's move to the chest and abdomen and see how this builds our case. By asking targeted questions about your digestion, the practitioner gains direct insight into the zhengfu organs and how your body's vital energy, or qi, is moving. Chronic diarrhea, for example, might reveal a spleen or kidney yang deficiency, basically a lack of digestive fire. Constipation could mean excess heat drying up your fluids, or a yin deficiency. A feeling of oppression in the chest points to the lungs or heart, while highly specific epigastric pain points right to the stomach. Simple bloating? Classic sign of spleen deficiency. Literally every burp, every ache is a crucial piece of the organ puzzle. And this brings us to what I think is one of the most profound aspects of this medicine. The crucial point here is that your emotions aren't just in your head. They are physiological events, and they are vital diagnostic markers of specific organ dysfunctions. Chronic anxiety or sudden irritability, that points to a stagnation of liver qi. Endlessly overthinking and obsessing over details points directly to an exhausted spleen. A deep, unexplainable fear points to the kidneys. If you have extreme mood fluctuations or depression, the practitioner recognizes this as the emotional root cause of your physical disease. Your mind and your organs are totally intrinsically linked. So, the practitioner follows a very logical progression to map all this out. Step 1, they gather the subjective info through intense, targeted questioning. Step 2, they identify the internal conditions, the heat, the cold, the stagnation, that simply do not manifest on the skin or in the pulse. Step 3, this reveals the deep underlying root of the imbalance. And finally, Step 4, they transform these scattered clues into a unified pattern differentiation known as bian-zheng. This pattern is the ultimate diagnosis, and it's exactly what dictates your personalized treatment plan. Okay, final stretch. Section 5, completing the diagnosis. Let's see how this entire puzzle is ultimately solved. It's super important to realize that the interrogation phase doesn't just stand alone. Asking works hand in hand with the other 3 pillars we talked about earlier. For instance, the practitioner might notice a pale complexion while looking at you. By asking, they confirm that you also experience fatigue and dizziness, which verifies a qi and blood deficiency. Asking identifies extra clues that listening to a cough might totally miss. And crucially, it validates the intricate symptoms the practitioner feels when palpating your pulse. Every single piece of clinical data gets cross-referenced. The source material summarizes this beautifully, stating, it's a deeply personalized diagnostic tool requiring empathy, active listening, and pattern recognition from the practitioner. Ultimately, this whole investigative process relies so heavily on the human element. You can't just run these subjective feelings through a standard lab test. It requires a profound level of human empathy and incredibly active listening to truly hear, interpret, and validate what the patient is experiencing in their own body. It really leaves you wondering, doesn't it? The next time a practitioner asks you a seemingly random, completely unrelated question about your sleep schedule, your emotional state, or whether you prefer ice water or hot tea, what invisible internal pattern might you be revealing to them? It truly changes the way you look at your own body, knowing that every small detail of your daily routine is secretly broadcasting the internal state of your health. Thanks for joining me on this explainer, and definitely keep paying attention to those subtle clues.